Um, so thank you everyone for joining us today. I just wanted to give a quick introduction. My name is Jenna from Kemper Pelvic Physio, and these are my two PTs here, Dr. Bridget Ochuko and Dr. Megan Beach-Gomes. They are who I like to call our pregnancy and postpartum powerhouse team. Not only from any physical symptoms that folks may be having, but from the educational standpoint as well. In addition to being a PT, Bridget is also a childbirth educator and a doula. So she has a lot of education on that front, and so does Megan as well, specifically with returning to exercise after a baby or continuing being active throughout your pregnancy. We also see everyone here in our office, so all birthing folks, including people who are going through IVF or who have had traumatic births in the past and would like to try not to have another one, but working through that. And we're really excited to partner with Kim, Brenley, and Sam at Steady Hope for this event, kind of talking through how we can be our best selves throughout pregnancy. And we did a postpartum version as well. Um, the Steady Hope is a really great mental health provider indicator. We're also right down the street from each other, which is great. So we love them and all of their providers there. What I really like is you all focus on trauma-informed care. So I think we work really well together in that sense. And I will let Kim take over just to give you a little bit of overview about Steady Hope.
Yeah, thanks, Jenna. So I am Kim, and I am the owner and director over here at Steady Hope. I have been a clinician since 2011 and started Steady Hope back in 2021. And I am joined today with Sam and Brenley, and Sam and Brenley are two other therapists on our team. And the three of us in particular are on this call today because we all three are trained in perinatal mental health and really love seeing clients in our offices that are considering starting their family, pregnant, postpartum, experienced a loss of any kind, maybe struggling with infertility. And we all see kind of other clients outside of that as well, but that's definitely a niche and an area that Brenley, Sam, and I really, really love to work with and to support. And yeah, I think for me too, just like being a mom of kiddos myself, this area in particular just like feels like such an area that I'm passionate about and passionate about connecting you with resources. And so Kemper PT has been an incredible partner for us, and we love referring back and forth and just love talking about the overlap. I feel like all of us preach so often just the value of having a village alongside you, especially in pregnancy and in postpartum. And so we just were brainstorming ways that we could support the community and these stages of life. And so I'm excited today for us to talk a little bit more specifically about pregnancy and how to be your best self, what ways you can take care of your physical and mental health, some of the reasons that you might seek out pelvic health PT, and just learning a little bit more from them and their expertise. And then some reasons why mental health therapy could be a value add and a resource to you while you're pregnant. And so, Brenley or Sam, do you guys want to share anything before we jump in?
Yeah, maybe I'll just do a quick introduction, but my name is Brenley Wiley, and I'm a licensed marriage and family therapist and been with Steady Hope since last year. I love working with the perinatal population. I love working with moms to be, and yeah, just walking with them as they navigate this transition so that they can become their best selves. And I've been a practicing clinician since 2019. So.
Yeah, and I'll just add, it's great to be here. I think my own personal experience too, not just as a clinician, but as a mom going through multiple pregnancies, I have learned too just the importance of building your village and what pelvic health PT has meant to me. And Yeah, I know when you're going through it, it can be difficult to balance all the things, but it can also be difficult to think about yourself and care for yourself. And so, yeah, I think just want to be one more person here to remind you, anyone that's joining us, that yeah, like you're worth like thinking about. Like caring for yourself is important. It's important for you, for your family, for your baby. And so yeah, I hope that you can glean some good little nuggets from this time.
Yeah, definitely. Bridget and um, Megan, I know the last time when we did the postpartum training, I think one of the like first questions we started with, like even for both of us, was like, what is the benefit of seeing a pelvic health PT? I mean, I know as I sit with friends or I sit with clients, they will often ask, like, well, don't you own like what is a pelvic health PT? And don't I only go there like if I'm having difficulties or if something like major is off? And so I would love to like hear from you guys in particular. Like, I know for me personally, like I went to pelvic health PT when I was pregnant, but that was because I just like heard the importance of it. But I would love to hear from you guys. Like, why would you say like what is the benefit of seeing a pelvic health PT when you're pregnant, and what can you guys help with?
Yeah, I'll go ahead and start. I'll start off with some things. I think I want to touch on the fact that we have all been kind of using the word village here, and I think that's really important. One of the little sayings I'll say to people that I'm educating is, everyone talks about how it takes a village to raise a baby, but it takes a village to make a baby and birth a baby. And I think that a lot of people don't realize that. And so us as pelvic health PTs and you all as mental health therapists, these are two really important professionals to include in your village as you go throughout this whole process. And so I think kind of starting from that foundation is important. And then, Kim, you also mentioned saying like people kind of only understand PT from the perspective of I'm hurt. And so I need to come in and get some care. And I think it's really, really important for folks to understand, especially if you're going through this journey of pregnancy and then moving into the postpartum phase, that PT can really be a really great form of preventative and preparation type medicine in order for you to have the best possible outcomes throughout this whole process. So I think that that's a really great point to say that you don't necessarily have to be in pain to come see us, especially when we're talking in the realm of birth, pregnancy, postpartum. It's a really great way for you to come in and get some what we like to call birth prep. And what we do is, and I'll kind of give like an overview, and then Megan, maybe you can go into some more detail, but we really take you through the stages of preparing your body in various ways. We really focus on your spine, your hips, and your pelvic floor, and we'll talk about why all of those things are important. But preparing all of those elements of your physical body to be able to come into labor and delivery and kind of ride through the waves of that entire process. And there's a lot of things we don't know about our bodies. And sometimes it just starts with connecting. So, kind of starting at that baseline of really getting into these certain areas of our bodies that are essential for us to be able to progress through labor and then ultimately meet our baby on the other side. Yeah.
Yeah, I mean, there's so many things we can help with during the pregnancy component because your body changes so much during pregnancy. And so Kim, you kind of mentioned, we think about this as like PT as an injury type of response, but the fact is that your body's going through so many changes. So like let's make sure you're actually adapting to those changes in an orderly manner. Pelvic girdle pain is incredibly common in pregnancy. I think it's about 50% of all pregnancies have some form of pelvic girdle pain. Um, PT is like a pretty quick fix for that. And in terms of we can set you up with some types of supports for it, we can modify the activity so you can continue to do your activity and still feel good with it. And then we can work on any strength imbalances that probably have cropped up as your center of gravity has changed, as your rib cage has literally widened itself out. Um, and as your abdominals have gone stretched throughout their pregnancy. And this is meant to happen. It's not bad or pathologic for that to happen, but the fact that those changes are going to happen for pretty much every single person means we are quite familiar with how we can really help along that path.
Yeah. Yeah, that was
Yeah.
really important. I also want to bring up, I think, what a lot of folks, at least what's been talked about more often, especially on social media, is talking about birthing positions and knowing how to push appropriately. And pelvic PT, like I'm a firm believer, and we are the experts in those two topics. Like, even if that's just all you want to come in and learn and prep for, it is, I mean, it makes a lot of changes in outcomes when it comes to really yourself as the birthing person, which we all think that's really important here, right? How important it is to kind of center the person who's actually pregnant. A lot of times the focus is on baby, so no one's really cares about the body that the baby is coming out of. And that's when we start to see all of this dysfunction. So you come to pelvic PT, we can figure out what positions feel good for you depending on what's happening in your hips and your spine. We can practice breathing to learn how to open up that pelvic floor for when the pushing is actually supposed to start. Um, and then throughout all of that, we do various things to work on strengthening muscles in certain directions, lengthening them, releasing them so that when you get to labor, you can go into all these different positions that'll maybe make it feel better as you're writing out contractions, which, luckily tend to be similar positions that are great for you to birth a baby in. So we go through all of that stuff. I think you especially, I mean, we always emphasize too, it doesn't matter what number baby you're on, there's always something to learn. Like we have a lot of folks come in here who have had babies before and they're like, you know what, I just want to approach this one differently. And they're like, I did not know about all of these things that you're teaching us right now. And so I think that we have a really good opportunity to show people how we can ride those changes in the body because they're inevitable, like Megan was saying. And if we kind of understand how to work through them, then a lot of times we have better outcomes when it comes to labor and delivery.
Yeah.
Yeah, speaking of outcomes too, like I know we have so many things to talk about.
Yeah.
But if someone's questioning if they should come into PT and they're like, I'm feeling great in my pregnancy. I feel like I know everything about the birthing process. If nothing else, let's come in and let's just like talk about perineal massage, and make sure that that is established. While it's a lot of people can read about it, it has really solid evidence on reducing the risk of high grade tears to the perineum. And those higher grade tears are more associated with fecal and urinary incontinence. And so if you can start off in your pregnancy reducing the risk for those tears, you're going to make your postpartum experience so much better.
Absolutely.
Yeah. Oh man, you guys just like covered so much and like hit on so much, but I think even a couple of things that you said like just really stands out to me of even just the way like mental health therapy and pelvic health PT can be so helpful during pregnancy. I think one of the pieces is oftentimes when we're pregnant, there is so much emphasis on preparing for baby and like thinking about sleep programs and thinking about what supplies you need for baby. But I mean, I think one of the kind of unique niches and areas that we really focus on in our practice and that y'all really focus on is like caring for mom and caring like for those birthing partners and just the community there of just preparing your own body and like realizing that you are about to experience a massive life transition and you're going to go through delivery before baby gets here and that your body is already going through so much. And so I think that's one thing that just like stood out to me is like just the ways that we get to like come alongside and really care for moms ahead of time and help you like think think about caring for yourself. And then I think too, just that like preventative, like proactive care of oftentimes some of the clients that we're seeing for mental health therapy are coming in even to be really proactive and preventative of thinking through, okay, I know I already experience some symptoms of anxiety, or I know that life transitions or change are really a big deal for me, and I'm about to go through a big one. Like, how do I prepare for that? Or they're just wanting to talk about how to prepare themselves and their partner. And so I think some of the ways that like a mental health therapy and pelvic health PT like get to be so empowering to the families that we're working with is that it can be preventative. It's really about focusing on caring for mama, preparing for these like big life transitions and experiences. It's really holistic. It's thinking about your whole self as you're preparing for this experience too. And so I think another thing that y'all said that really stood out is pregnancy is obviously so common, but how often we like don't know a lot about pregnancy, and we don't know a lot about our body and the biology of like what parts of our bodies are like impacted by pregnancy, and how are we gonna like even navigate that mentally and emotionally. And so I just love all the things that you said. And so, I mean, Brenley and Sam, I would love to hear even from you guys, like what are some of the common reasons, or what's the benefit of someone seeking out mental health therapy during pregnancy? What could they talk about?
Yeah, absolutely. And I totally want to echo everything Kim said. You guys are so knowledgeable, and I love everything you said. I think that especially women, yeah, it's all about baby, and as it should be, but also mom. And so I love that even just reframing it as these spaces can be spaces for mom to be taken care of, because ultimately a healthy mom makes a healthier baby. And so I love that. But yeah, great question. So what is the value or benefit or reason for wanting to see a mental health therapist during pregnancy? So I think there's a lot of really good reasons. I think one, even just to kind of address that some pregnancies are planned and some are not. We know that about half of pregnancies are unplanned. And so I think addressing this part of pregnancy that isn't always addressed is a really important thing, just to provide client space with, okay, what does that look like if it was planned and, you'd experienced infertility beforehand? Or what is that like if, this is this thing that you've been wanting for so long and now it's here, and what does that mean for you? That's definitely, kind of a first thing that comes to mind. And I also think it's a safe space for you to process anxiety or anything coming up with your own pregnancy. I mean, it's not uncommon for women to really begin processing, maybe even for the first time, some of the things they experienced in childhood with their own mothers, or maybe lack of a mom figure or a stepmother or something like that, as well as even just like anxieties of, this is my first time doing this. Like, do I even know what I'm doing? I knew I wanted this, but am I prepared? Am I adult enough to be, the mom here? And so I think it's just a really good space for women to just feel seen and heard as they process some of this. So yeah, I don't know if Sam, you want to add a couple other things too.
Yeah, I think I wanted to echo too just the point that Bridget made, that you don't have to have a problem to be seen. Like it's the same way in therapy. Like you don't have to wait until you feel like your world is falling apart or you have a diagnosable disorder to come to therapy. As we've all said, it's something that can be supportive and that you can use to be proactive. Just like how everyone who births a baby has a pelvic floor, like everyone who births a baby is also a holistic person, and it has a mind and has emotions and has a past, and all of those things are being affected in pregnancy, like currently, all the changes your body goes through. For some people, like they're able to encounter those transitions and those changes and feel minimally impacted. By other people, like it's a lot to feel your body changing and feel something moving inside you, and like even that alone, just like how your physical affects your mental. I think clients come in and really process that. I think yeah, I see a lot of clients who maybe this is their second or third baby and are just like, I want this time to be different. I want to prepare myself differently, but also being pregnant again is like bringing up things from the past that maybe feel unresolved, from, the previous time you were pregnant. Maybe you encountered some birth trauma, or maybe you had some complications in pregnancy and that's triggering some things for you. I think getting some support in that way of being able to not only process last time, but to, receive some support and some coping mechanisms of like, how can I move through this pregnancy feeling, more stable, more empowered, more calm. And then I think a big piece too is, yeah, just putting together that postpartum plan, like considering not just physically, but emotionally, like socially, like we've said, building that village. What does that look like for you? And I think a big thing we talk about in therapy often is relationships. Like, how is this going to impact your relationship with your partner, with the people in your home, with your friends, with your parents, like figuring out what do you really want for yourself and your baby, and maybe, how can you work on communicating that to other people.
Mm-hmm. Yeah. I love everything that you said, Sam. I think that covers such a wide array of topics. And I love what you said, what you've all said of like, there doesn't have to be anything wrong. I mean, I even think therapy can help you just prepare for how do I share this news with people? And that can even just be something so simple but intimidating, to talk with others who may be in a different stage of life or, being mindful of people who are struggling to get pregnant. And so just even having a space, a non-judgmental, safe space to talk through it, and even just exploring ways that you handle stress and considering what does that look like in the future when I'm going to have more stress and less sleep, and just kind of getting that discussion going. I think while you have maybe the bandwidth now, but you might not when baby gets here, just kind of going ahead and talking through some of these things.
Definitely. Definitely. I mean, I think I've too often as a mental health therapist, sometimes we're the first people to know that our clients are pregnant and they haven't shared with their families yet or their community. And just like what an honor that is to be invited into that space. But even in that space, like for us to get to lean in and hold with them whatever emotions they have leading into those first ultrasounds or brainstorming how they want to share with their family or even navigating or thinking through like if they've got a close friend or a family member that recently experienced a pregnancy loss or having trouble conceiving and they don't know how to share with those friends. Those can be some early on conversations too, and just feeling like you've got somebody in that sort of time period often before you've shared with the rest of the world that you're pregnant.
These are all really great points, and I think that's what's so valuable about talking with healthcare professionals in other fields because you're thinking about this whole approach to how we can address different mental health things that may come up at different moments. And I loved Brenley talking about when you were talking about like how do you even tell someone this news? Like that is something that a lot of people don't think about could
Yeah.
be difficult. And I think that's really important. And I want to point out that we're all talking about a parent taking the time now to center themselves throughout this whole process. And that is something that I think if you can start to practice as soon as you can before your baby gets here, whether it's your, like we said, your first or your second, third, fourth, um, so that you can kind of take those practices in as a parent, right? Because that's one of the things that so many people talk about is that element of losing themselves throughout this whole process of raising children. And if they can start to implement these practices, physically putting themselves first. I talk about this all the time, like with my birthing people. They come in and I'm like, they're like, you know what? I left baby at home today because this is my time. And I'm like, that is great. Like that is exactly what it should be. And we shouldn't feel guilty about it. And it kind of reminds me of how we were talking about mom guilt being one of the mental health symptoms a lot of people deal with in the postpartum. And I want to know if you all see a change in how people are mentally postpartum if they're able to start therapy early on. I know from our physical side of things, people come in and do birth prep with us postpartum, they look great postpartum.
Yeah, they're surprised at how good they feel
Yeah,
too.
yeah, exactly. So I want to know if you see that in like the mental health space as well.
Yeah. Yeah, I was like, wait, I don't know who wants to answer this, but yeah, definitely. I would say, gosh, I think some of the moms, I think the biggest thing is having that extra support. I've even had a couple of my clients like be like, okay, I know I'm giving birth this day. If it goes well, whatever, but can we go ahead and schedule like, X date or whatever? And I think for some of them, it's been really comforting just to know they have someone in their corner that's this dedicated time for them. And it's been so beautiful for me, like to meet with some of these moms virtually and maybe they're nursing or baby's sleeping or whatever, and just checking in. And I think so many of them have been so grateful that we've had the time and space to discuss some of these hard things. And now that baby's here, just kind of continuing that dialogue. And I think some of them, even as new things come up, maybe we've already worked on skills of, okay, how do we cope with this? How do we deal with this? What is your support system? How can we identify, the hard emotions that are going on here? And so I definitely think I've seen a difference. And it's been really beautiful to watch for all of my clients.
Yeah, I would say, I have some clients who I have been working with before they get pregnant, and then we get to journey in that together. And just building that rapport, building that relationship, I know means a lot to them, kind of like what you said, Brenley, like postpartum, to like know like, okay, this is my time where I can spend my time with my therapist who really knows me and I can be really honest and really vulnerable. I know that means a lot to them. But I've also had clients who have only seen me, a handful of times before they deliver. And of course, we only are getting to know each other so much, but we're able to really talk about that postpartum plan and, what they really want, what their goals are for themselves. And I know when I meet with those clients 6 weeks out, 12 weeks out, whatever it is, I have that plan. I know what we've talked about, and I can be that source that reminds them, like, hey, remember we talked about this? Like, how are you doing in this area? And how are you doing in this area? And even just like help brainstorm simple suggestions of like, okay, one of your goals was getting out of the house, once a day. Like, how can you do that today? Like, how can you step outside on your back porch? And it's like light bulb, like, oh yeah, I said that'd be good for me. That would actually be really good for me. Thanks for reminding me. So yeah, even that, just knowing that we had put together a solid plan before, it makes the work after more helpful too, I think.
I think something you guys like really just said too that I'm thinking of kind of in contrast to clients that I've seen maybe just like postpartum versus the ones that I've seen even for a session or two like in pregnancy is I think because they've already built their relationship during pregnancy, they'll reach out quicker and they're like kind of even more attuned to noticing like, okay, like I think that I'm struggling maybe a little bit more. Than I thought that I would be in this moment. And so they may reach out to a counselor sooner. They already feel like they know someone. They're not in the like sleepy haze or the overwhelmed haze of trying to like figure out how to find a therapist. Because, I mean, to be honest, it can be hard to find a mental health therapist and a pelvic health PT, especially during those like early days, kind of after getting a baby and when you're already feeling overwhelmed. And so I really have found that clients that have established a relationship ahead of time often reach out a little bit sooner or reach out a little bit more proactively or just or noticing things that are coming up for them and kind of more willing to reach out and say like, hey, like I just want to talk through what I'm going through to see if I'm like okay, if there's any other tools I can add in, or any other resources.
Certainly. I think having that touch point is so important too. Because there's some folks who I see maybe like I've seen a few people in the first trimester and they're like, I just want to set up care. I'm feeling good. And I'll be like, great, let's see you in like 4 more months and see how you're doing. And then we maybe will do a little bit of prep during their pregnancy for like positioning and that perineal massage. But then if they're feeling good the whole time, it's not like I'm going to see them on a weekly basis. But that way they know okay, if something does crop up, I don't have to get on a wait list. I don't have to find someone close to me. I can just email me or set up an appointment really quickly, and we kind of already know where your body is, and what maybe like changed during that time if you have symptoms, but also it makes the postpartum period so much easier too.
Yeah.
I had a question for y'all too, because obviously there's things that I think everyone knows going to pregnancy, my body is going to change. And we know it from the musculoskeletal and the like physiological standpoint. But I think something that's really hard is knowing ahead of time your body's going to change and then seeing it actually change can be so alarming. And that's not something that, I mean, we focus on the how you're feeling with your body, but I think like living in your body is a little bit different too.
Yeah.
Like those body image issues.
I
Absolutely.
think the body dysmorphia of it all is really confusing. And I think even women who know, like, okay, I'm going to gain weight. I know I'm going to carry this baby and my body is going to grow. It's almost like you know it, but sometimes your heart can't. There's like a disconnect there. And so,
Yeah.
and two, even just acknowledging that every pregnant body carries weight differently. And so you might look different pregnant at 5 feet versus my friend that's 6'1", like your body is going to look different. So I even think there's that comparison game of, oh gosh, I don't look how I used to, but also I don't look different or I look different than my other pregnant friends. And this idea that gaining weight while pregnant, like it's a good thing, right? Like you want your body to be able to carry baby, but also that can be a hard thing. We've also had clients of, that have shared, people saying, oh, you don't look very pregnant. And that even being harmful to them of like,
Yeah.
and just there's just so much there. And I think if anything, I've learned that we don't need to comment on other people's bodies, regardless of where you're at. And I know it can be a quick thing for people, but yeah, that's definitely something that we work on. And we talk about strategies of, if even like gaining weight is a trigger for you, maybe we do blind, weighings while at the OB. I think also sometimes there's a lack of education around weight gain in pregnancy, or maybe a lack of conversation with your provider. And so that can even be kind of, I don't know, just interesting to work through. Not understanding, like, is this too much weight? Is this not enough weight? I also feel like I have body issues myself. And so how do I navigate that? And that's certainly something that we talk about with some of our clients. And it's certainly a challenge for a lot of them.
Yeah. I think I'd add to that too, it just kind of depends on your life experiences and your life story. Again, like seeing your body change, like you said, Megan, like for some people it's like, oh, okay. But for other people, it can feel really disruptive. And I think I just want to normalize that, or say like that's okay if it is disruptive, but you don't have to carry that and process that alone, whether that's like bringing up honestly some kind of trauma from your past, or if it's just you're not a person who's in touch with how they feel in their body. I know I do a lot of work with clients in that way, like somatically, like what does this emotion feel like in your body? What does this experience feel like in your body? And for a lot of people, even in our American culture, I would say, we're very like separated, or can be very separated, like the mind and the body. And so to normalize that and like gently like lean into that, like knowing that it's safe to notice what's going on with your body. Because when you're pregnant, you're going to notice it one way or another.
Mhm.
But like giving more invitation on how to like do that in a helpful way, or in a way that feels safe to you.
Yeah, absolutely. I mean, something I think, Sam, when you said the word disruptive, it made me think about one of the other pieces that we can hold space for clients in is just talking about the like wide array of emotions and feelings that can come up during pregnancy. And that I think there can be this societal sort of like expectation, or just sort of sentiment of like, well, you're pregnant and you're going to have a baby, like it's full of joy. And just like they were even talking about kind of with body changes, like it may feel hard to notice your body changing. You might be afraid of what that might be like afterwards, or you might be sad to lose some of the like freedoms that you had before you got pregnant, or before kind of this stage of life, and you can be excited at the same time. And so I really do. I think we get to hold space for just the wide range of emotions.
Absolutely. Yeah. Yeah. I think kind of bringing it back to what we address in physical therapy when it comes to body image and kind of this changing body is really working through this acceptance phase, which works really nicely when someone's also in mental health therapy as well. But there's this whole process of accepting that you're essentially a new being. You're a new individual once you have had a baby, especially if it's the first time you've had a baby, right? So you've gone from this space where your body has been your own the entire time. No matter what struggles you're dealing with, it's always been your own struggles. And now you've gone through this process, or in the process of creating and supporting a life, and then coming out on the other side and seeing that everything is different. And just like everyone is saying here, for a lot of people, that can be alarming, disruptive. Love that word. But, and then so also you just have to let people know, just like you said, Sam, before, that it's okay to be unsettled by what's happening, but then to also understand that that is the process that has happened, right? And so who you were before physically, this is what we touch on physically a lot, who you were before you had the baby physically is not going to be the same now after, but that's not necessarily a bad thing, right? We're just learning how to work towards accepting what our new normal is. And that can take a really long time. Like one of the things we talk about a lot with our patients is I'm just trying to gauge like when people start to feel like themselves again, because it gives us more data and understanding, because we know there's not a lot of evidence, there's not a lot of research done on pregnant people. So to be able to give people an idea of what to expect is really difficult. It's all anecdotal. All we can do is listen to what people are saying. In my personal opinion, I love anecdotal evidence. I think it's very, very strong to be able to listen to people's experiences. And so then you start to hear these things. And I mean, it takes people, some people minimum a year before
Mhm.
they start to feel like they're back to themselves again. And so for some people, for anyone who's listening to this, no matter what phase you're in, even if you're thinking about it and you haven't even gotten pregnant yet, it is completely normal to kind of go through all of those changes and experience those things and have to work through those and feel a little scared and nervous about all of those things. Yeah.
Yeah. Oh, I'm so glad that you like mentioned that, Bridget, too, of just even holding the space and creating space that like after you have a baby, obviously like you have changed, but that like that 6 week checkup appointment doesn't mean as much as like we mentally are kind of like told or anticipate that appointment meaning. And so, I mean, even for you guys, like what are some of the things that you do as you're working with a pregnant client, like preparing them for after delivery or even preparing them for delivery?
Yeah, I mean, Um, so we kind of think about like the actual delivery itself. I kind of call it like there's a hallway and then we have the exit. So we want to make sure the hallway, so like their hips, the hip flexor muscles, everything that's kind of helping support baby. We want a more open hallway. And then we want to make sure that door is as open and mobile as possible. And so when we're doing that, we're going to make sure hips and spine are mobile so those hip flexors are not rock hard and closing that exit or closing that hallway up. And then we want to make sure your pelvic floor can actually move in all directions. And so that means not only having flexibility within your pelvic floor muscles, it also means, is this birth position going to be optimal for you? And so we go through different birth positions. And that includes if you plan to have an epidural or if you don't plan to have epidural, because there are still more than one position that's typically portrayed in like all media, which is on your back,
Mhm.
and actually kind of closes off the mobility of your tailbone. But there are ways to work around that too, which we do go through. Um, and that is like one of the biggest things we can do, I think, for folks in like a really short amount of time is just like, let's prepare, if nothing else, just for what's going to happen on delivery day.
Yeah, absolutely. That's probably the bread and butter. That's the meat of it. When we get the opportunity to have time with people, I think a big part of what we're doing is improving that brain-body connection. So essentially, we're talking about neuromuscular control. So the ability for you to make a decision for something to happen in your body and then physically be able to do that. And so when we are disconnected from our bodies, as we talked about earlier, it's a lot of us out there like very disconnected, let alone being disconnected from our pelvic floor, then that kind of the natural progression is a little hard to tune in to. And when it comes to labor, delivery, birthing, listening to what your body and your baby are telling you is the way to have the smoothest type of labor and delivery that you're hoping for. And so I like to what I love about birth prep is that it's so relative to everything that our pelvic floor does for us. So when I start talking about like pushing and all the things, I'm like, let's think about when we learned how to poop the right way here, right? So we talk about that all the time, and it's very similar. We want to open up that door so poop can come out and you feel really good. And it's very similar to what's happening when you are pushing your baby out. And so being able to understand urges, feel them, breathe with them instead of kind of tensing up and pushing them away. And learning how to ride those urges really, really helps people have like that shortest second stage, which is the pushing phase, right? Have reduced trauma, pelvic floor trauma, hip girdle trauma, whatever kind of trauma happens. A lot of things can happen during delivery of your baby. And so being able to listen to what your body is telling you really helps folks kind of come out on the other side with better outcomes.
Yeah. I have a couple follow-up questions for you guys. I think I'm just thinking of even clients I have who, or people who might be listening to this and are like, okay, I wish I had gotten in with you guys sooner from the beginning. Maybe I only have weeks left in my pregnancy. Like, is it helpful even if I can only get one appointment with you guys? And then kind of follow-up question is, I'm just thinking about people who maybe know that they have to have a planned C-section, or maybe, more towards the last minute, it's like, oh, I put in all of this work, but I ended up having a C-section. Like, how can pelvic floor PT even help those people?
Great question.
Yeah. So, I mean, I see people, there are people all the time who are like, I'm 38 weeks pregnant. I heard this is good for me to do before I give birth. And we're like, all right, we'll try to see you this week. But again, if we can get you in for one visit and you can do that perineal massage until you give birth, if you can just have a few more strategies to, like, for your comfort measures to actually give birth in terms of like positioning, great. We will do as much as we can in that like 1 hour we have. Like, that is not an issue. 1 hour better than no hours, and like a lot better than no hours.
Yeah.
And then C-section wise, like we have quite a few people who have planned C-sections or unplanned C-sections. There are some differences in recovery, obviously. And some folks, I mean, even if you have a planned C-section, I will still probably go through some different positions with you.
Absolutely.
Just in case something goes down. We always want to be prepared. But also, we don't necessarily, we'll see some folks for telehealth maybe in the first few weeks postpartum, but we might see someone in person maybe 4, 5, 6 weeks out. But that does not mean you don't have to do activity until we see you. And so we're going to help set you up with some exercises, some like core connection work, some breath work that you can easily do like day one postpartum. And that is if you have a C-section, if you don't, we can easily help set that up.
Yeah. And to just go ahead and dispel the myth, a big myth that's out there is that if you have a C-section, do you need pelvic health PT? And it is like 100,000% yes. Like, we will even say sometimes those folks need it more than people that have vaginal births. And so just to give like a good baseline understanding, if you're going to have a C-section, that is the most intense abdominal surgery anybody could have, period. And they're cutting through all of your abdominal organs or all of your abdominals, and then pulling all of your organs out so that you can meet your baby, then putting everything back in. When you think about that, that's really intense, right? And so if we understand that, I know I have to go home and like be a participant in taking care of my baby. I need to be able to carry my baby and stand up and hold them while I am breastfeeding, if that's what's happening. All these things that you have to do as a parent, a lot of times people aren't educated on how can my body be in the space where it needs to be so that I can do this to the best of my ability. A lot of times I feel like, especially with C-sections, like people are sent home with instructions not to lift more than like 5 pounds
Yeah.
and it's like, I have a baby. Like, I don't understand how I can't lift that much weight. And it's not that you can't, it's how you lift the weight. And so they just need someone to kind of talk them through it. And I think too, we talk a lot about this, and this is really why it's great to have mental health therapy in conjunction, is that whole scenario of an unplanned C-section. So many people experience that. And one, just being able to sit with that before you get there. I think that's so powerful. Like, I have people that you have your whole birth plan, right? But it's a preference because we can't plan birth. So these are your preferences, and you have multiple preferences. And so if a C-section is what you absolutely don't want, it's going to be your last preference because it's a possibility that that could happen, right? No matter what. There are many medical reasons why people have to have C-sections, and it's just medically necessary. And so sitting with kind of that type of acceptance is huge going into it, and can really, really help have just like better thought processes with having a C-section. And then just to go back to that too, talking about like your pelvic floor, just because you're having a C-section doesn't mean your pelvic floor isn't impacted. I mean, you've been growing and carrying a baby for 10 months almost, right? And so we're talking about all the same changes happening in your body as anybody else. And it's putting pressure on your pelvic floor, it's putting strain on your pelvic floor. We want to learn how to connect and move through with it, move through and move that muscle, even if you're getting a C-section, because all of that is still really, really important. So we're just really focusing on people connecting with all these parts of their bodies so that they can just really listen to what they need as they progress, especially through those early stages right after baby gets here.
Man, you guys can do so much. And so I'm so glad that anyone that is watching this is just really getting to hear all the ways that mental health therapy and pelvic health physical therapy can come alongside you and support you when you're pregnant and when you're postpartum. And I mean, I think especially Bridget, when you were just sharing about like the mind body connection, like the thought that just kept coming to my mind is that sort of idea that when you're pregnant, you're essentially like running a marathon probably multiple times. Um, and I think we just don't like give enough credit to ourselves as like pregnant women for all the effort and energy
Mm,
and the output that is happening and just how we wouldn't go like I am not going to go sign up to run a marathon and not train and not prepare for it or talk
exactly.
to a coach and like that just would be so silly. I like would not be able to move or finish the race. And how just this like feels like signing up for mental health therapy or pelvic health PT is your coach. Like it's who's going to help you just even like feel more supported and equipped and to be able to do the things that you need to do when you get home with a baby. And I just when you said like that so often, like you leave the hospital and they tell you not to pick up more than 5 pounds, that's like such a joke of, I remember that
Mhm.
especially when I was going home with my second and the doctors told me not to pick up more than 10 pounds. And I'm thinking, I have a 2-year-old, like I have
Mhm.
to pick up my baby. And so it was so helpful for me to have like strategized some with my pelvic health PT of like, what are some of the ways and the things that I can be mindful of when I'm carrying and picking up my baby? Where's a good spot for me to like hold him? Just to be mindful of the fact that like I am recovering from delivery.
Mhm. Mhm. Absolutely. I think that's a good point. And I also want to bring up because I feel like I feel we would be remiss if we didn't touch on the state of maternal health in this country in general. And a lot of people are scared to get pregnant, have a baby, deliver, and rightfully so. And I think that one of the messages I really try to promote is if you're able to invest in your pregnancy and postpartum, this is a time when you need the support as much as you can get. And once you start to look into things, you start to see that there are other things out there. So everything might not cost money, but I think if there's a time to invest in yourself, it is throughout pregnancy and going into that postpartum phase because we all need as much support as we can get right now. And we need to create that kind of um, consistent availability to having a village is what I think we need to do because I think for a lot of people that's intimidating and they're like I don't even know where to start, which is fair, right? And I think societally we just need to start working towards making that more of the norm, so that we can support all these people out here who desire to have kids, and don't want to go into it terrified, you know?
Absolutely. Because I mean, I think something that you guys highlighted on too is how much the focus is connecting to your brain and your body and like just even recognizing what's happening. And so I think all of us would encourage pregnant and like post-delivery women to really be mindful and to trust their body. And if something feels off, like keep bringing it up to all the providers around you and hopefully someone is really going to listen to you or at least point you in a good direction or trust your instinct of if something doesn't like feel right with that provider to find another one.
Mhm. Mhm.
Yeah, I think unfortunately pregnancy is a time when you have to really, really be an advocate for yourself.
Hmm.
And we're happy to be our patients' advocates too. But like we like to tell them all the signs and symptoms of preeclampsia. We take
Hmm.
blood pressure here just so that people are not, like gaslit. Unfortunately, that is something that can happen in a medical setting. We hope it doesn't, but it can. But we want people to be able to have the tools to advocate for themselves, have the verbiage that they can actually use in those situations. You do an excellent job with that.
Yeah, yeah. And then all of what we're doing here and all of what we do is going to contribute to reducing maternal morbidity and mortality. And I don't know if everyone can see those dots being connected, but it's so true and it's so important. And I think that maternal mortality is talked about a lot. And I think we should talk about morbidity a little bit as well, because it's these conditions that come maybe due to birth trauma, something happening during the delivery, not being able to stay active during pregnancy, and now we have preeclampsia. All of these morbid conditions that can then contribute sometimes to maternal mortality, but I can't remember the exact number, but I think it's like for every maternal death, there's like, I think it's like 50, is it 10 to 15?
Yeah.
Like people deal with maternal morbidity. And so I think that us emphasizing how having all these people in your corner can really, really help reduce chances of that. Then in the long run, you're saving time, energy, money, and distress. And so it can seem like a lot in the moment, but if you do this during this time, it's going to be so much better in the long run, so much better for you in the long run.
Yeah, yeah. And I think I can speak for us, and I think I could speak for you all too, that, that is why we're here. And that's like why we're passionate about supporting birthing people and birthing families. And so even if you can't afford, private pay like therapy or physical therapy, like if that is a roadblock for you, like I know we at Steady Hope are so happy to talk with you and point you in directions that where there's not that cost barrier or that financial barrier, or work with you in some kind of way, so that, again, like we want to see people have access to these things, whether it's with us personally, like we would love to be your providers, but even if it's like connecting you with someone else in the Decatur or Atlanta area, I know that we're all advocates for that as well.
Mhm.